Hi, my name is Scott, and today I'm going to talk about trach care. So what you want to do first is indications for this is if the patient's trach is visibly soiled or if they need cleaning. And what we're going to do is we're going to check for check significant findings in patient's charts to see why they were trach, whether they need like to have a patent airway or they have any secretions or anything like that. So you want to gather your necessary equipments, and you would need your little trach kit. You're going to have your 50-50 solution, so it's going to be sterile water and hydrogen peroxide. You're going to have another little box right here for your hydrogen peroxide. You're going to have four 4x4 gauzes, your pipe cleaners and brush, so you can clean their inner cannula. You're going to have your obturator, which is actually there to help basically if they like decannulate, if they cough out their trach, this will help guide it in safer. You can have your four Q-tips. Extra is okay. And you're gonna bring an extra inner cannula. Your 3 mm syringe, their new tie because you're gonna be changing. Pulse ox, and then another gauze but split, and like a little sheet just so you can keep their gown clean. So as of this time, now you can walk into the patient's room. You would knock in, introduce yourself to the patient. Hi, my name is Scott. I'm a student respiratory therapist, and today explain to them what you're gonna do. Today I'm gonna be cleaning your trach area and just cleaning up. And before you do anything with the patient, you want to make sure you wash your hands with 3 ml of hand sanitizer, and then grab a pair of gloves. Okay. Then when you walk into the room, you can check their ambu bag. Make sure you do the three-step check. So you want to make sure that the duct bills open up when you press down. You want to make sure that pressure doesn't come out when it's occluded, and you want to make sure that it reinflates when you occlude the front part. Okay, so now that you check, and then you also want to make sure there's mask piece, just because if they cough out and they decannulate their trachea, then you could occlude their stoma, and then you can put the mask on and then give them breaths. Okay, and then the patient is on either oxygen or a humidifier. Just note that you want to listen to the patient's breath sounds and then check their vitals real quick. Okay, and if you're listening to their breath sounds and you hear any weird noises like crackles or anything, then that may mean they need suctioning. And then you put a pulse ox just to check their saturation levels. Okay, and then make sure you explain to them, the family members, what you're going to do, and the hazards. With contraindications would be to not do trach care and not clean their area if they've just been trached for about 24 hours. You have to wait. And then hazards can be they can cough, they can have low tracheal bleeding, and then also trauma can happen, and they could be irritated and be sensitive and cough. Okay. So after that, let's see if everything is here. So you want to take this off. Okay. Make sure you put your 50-50 solution in here of your saline and your hydrogen peroxide, and then your sterile water in here, and then put your hydrogen peroxide in here too, so you can clean out their inner cannula. If they have a metal one, which is not a disposable, then this is why you have an extra inner cannula. You're gonna take theirs off and clean it, and then their metal one, I think it's usually normally called a Jackson. They have a 15 mm adapter to it, which can be adapted with the ambu bag because it just doesn't fit on an ambu bag. So what I like to do is, before I clean, I want to let them know that I'm going to take out their inner cannula first. This is how I do it, and then I put a disposable one in. it's there, just put it in the hydrogen peroxide. Okay, make sure there's a click sound. That means that it's in, because if it's not, then they cough, it'll fly out. And when you're doing trach care, you want to make sure you stand on the side and not in front, because then they can get phlegm all over you. Okay. And at this moment, you're gonna let them know you're gonna take out their old gauze, and then before I start, I'm gonna put in this. Okay. Let them know that you're gonna be in their face a little bit, that you're gonna be kind of close, so that they don't feel weird. Okay. So you're gonna have 4 Q-tips on each side for gauzes, 2 gauzes. So technique is when you go in to clean, you want to make sure you go inside, and then you want to roll and just clean it nicely and make sure you're not introducing any other bacteria. You want to get a new one. So that one. Get another one. I'm using the 50-50 right now. Just clean inward and turn. And this is a good time for you to check to see if there's any irritation or any rash or anything. And if there is, then you want to chart it and put it in your findings. Okay. And now you take your gauze with 50-50. You're going to come in and clean. You kind of get in there and make sure it's clean. Make sure the cuff is out of the way. Just wipe. And then you can fold. Make sure it's a clean end. And wipe. Dispose of it. Take another one. Okay. Fold it. Now what you want to do is you want to take your solution of just sterile water or saline, and now you want to clean it again with the gauze, a new gauze. Okay. Grab another one. After you're done, you already have his inner cannula out, so it's already sitting in the hydrogen peroxide. What you want to do is you want to clean it, scrub it, and then you want to rinse it with sterile water, and then you want to try to air dry it because it is going back into the patient's trach, and you don't want any liquids in there. And then you can change it one more time. Okay. Dispose of it. Okay, and then like I said, you don't want to hear that click sound so that it doesn't pop out if they cough or anything. Okay, and then at this moment, I'm gonna actually change their collar first, and then I'm gonna put their split gauze on. So you let them know that you're gonna be kind of close to them, you're gonna be working around them. So slip this underneath. So this is the phalange. You want to make sure that you hold this tight if you're gonna take off their collar, because you don't want to decannulate their trach. Okay, sir. So when you have it on, you want to make sure you check if it's tight enough so it doesn't fly out. And 2 finger spaces would be good. Okay, so this is a little loose. There we go. Okay, so now it's nice and secure. Okay, now what you could do is put this on. Grab a new Q-tip, and I like using the end of it to help kind of guide it through. Okay, lift it up just a little bit. There you go. Okay, this moment I could actually take this off. Okay, and if you need to, you can post-oxygenate the patient because they might need oxygen because they've been off, and you want to reconnect. Nothing yet because we have a passive mirror valve. Some patients may have a passive mirror valve or a fenestrated valve, which is meant for them to talk. And if they don't have one of these, just leave some kind of writing, like a pencil or paper, so they could verbalize stuff with you. And with the passive mirror valve, what you want to do before you put it on is 3 steps. You want to suction out the oral area. Okay. And then you want to make sure their cuff is deflated. And then you want to put on the passive mirror valve. Okay. All right. And then to check cuff pressure, usually there's a way you use a manometer, and it's usually the pressure, your level's usually at 20 to 30, and if you look at it, it's usually on the green end. So anywhere between there or even a little under 20 is okay. If you don't have one of those, like right now, have a syringe, you could do the this is without the passive mirror valve on. So you want to minimal occlusion technique is when you want to make sure that it's deflated, and you want to make sure that you have your stethoscope on. Listen to like an occlusion. So what you do is you deflate it and then you start inflating it until you hear an occlusion. Okay, so that's the occlusion technique. And then for the leak, you want to make sure that if there's too much air in it, then you want to make sure you pull out until you hear a little bit of a like leak sound. And then you want to listen to breath sounds and make sure they're okay. So, take a listen to breath sounds. Oh, he sounds fine. Okay, check his oxygen level. Boom, cool. Take it out. Don't forget it. Make sure you chart any of your findings. If there's anything, like see if they're tolerating it well, and then make sure to put it back into his humidifier or oxygen before you leave. It's alright, Mr. Jacobs. Alright, so after that, his area looks okay. He says he's feeling fine. Take your trash. Take any of your trash from your area, disinfect and throw it away. Take off your gloves. Wash hands before you leave. Use a hand sanitizer. Chart everything, like chart your findings or anything like that. And then yeah, I think that's about it. Yeah, thank you.